Welcome to this podcast on immigrating to the USA for healthcare professionals. My name is Dr. Tom Madayag. Our topic for today is clinical adaptation for newly arrived nurses here in the United States. One of the major concerns of nurses is that of the clinical adaptation that they might have to encounter once they arrive in the United States. Starting in a new clinical area is always stressful. And just imagine you coming from abroad and coming into a new working environment with different personnel and new culture. It always is going to be a challenge. But there are some techniques that you can use and implement in order to make it less stressful. The first one is to develop an attitude of the willingness to learn. When you arrive in your unit and you have a preceptor that's orienting you, open yourself to the possibility that now you are a student and that you will express your willingness to learn. A lot of times, the problem that people oftentimes experience in the workplace is that they resist the learning process because they feel that they are looked down upon because, after all, you might have been practicing for 5 years, 10 years outside of the United States, and all of a sudden you come over and somebody teaches you. The added fact also is that the one that teaches you or orients you might even be younger than you, and you're thinking, who does she think he is? But you have to humble yourself because this is a new learning environment, and it is not to say that you are not skilled or you're not good enough in this particular area. It's just the fact that you are adjusting to a new place. So the first clue or the first technique to dealing with the adaptation to the clinical environment is to humble yourself and make sure that you show a willingness to learn. After all, there's a lot of things to learn because each hospital and each location will have their own specific way of doing things. The other thing that I'm going to advise each one of you that are just starting is to make sure that you establish a good relationship with the people that you work with. Be as friendly as you can be as sociable as you can be, because the more relationships and links that you establish with people that you work with, the easier it is going to be not only for you, but also for them. So make sure that you have a friendly attitude so that you become a lot easier to adjust to, and you also will adjust easier to the people that you work with. The other thing is that always seek for new experiences by asking questions. A lot of times, nurses from the international arena that are trained outside of the United States are acquiescent in the sense that they usually are afraid to ask questions. The source of their fear in asking questions is usually the fact that they think that by asking questions, you're showing your stupidity, which is actually not true. So the more questions you ask, the more clarity you're going to have. And in fact, by asking questions, the people around you, particularly the one that is orienting you, will really know that you are engaged and that you're interested and that you're willing to learn. People who usually don't have any questions are either shy in expressing their particular questions or maybe impart the notion that they know it all. Being humble is very, very important so that you can become successful in your orientation. The other thing that I'd like for you to do is to make sure that you look at the things that you are having difficulty in the clinical area. So, for example, one area that you might not be very, very good at is documentation using the computerized charting, that this is not a way that you document. If you haven't had that experience, humble yourself. Tell your preceptor. Be honest and say, you know what? I really don't have any experience in computerized documentation, but I'm willing to learn. Could you show me how? I know that this is part of your orientation, actually, is being oriented to electronic medical record. However, the practical aspect of it, when it comes to an actual patient that you now have to document, you might meet some challenges. And therefore, the assistance of your preceptor is going to be very, very important. I must also caution you that overly being dependent on the preceptor for things is going to be not favorable. An example is if you ask help for every simple things that must be done, then the preceptor might think that you really are short of the basic knowledge that is required to work in that particular unit. Be very, very wise in choosing the questions that you ask as well, because it is obvious and natural that if you are the preceptor and your preceptee is asking very simple questions that require common sense to answer, then the perception is that you really do not have the qualification to begin with to work in that particular area. So starting in the clinical area here in the United States could be very challenging. Always make sure that you utilize the clinical orientation that is provided for you in order to learn whatever it is that you need to learn. This is the reason why I must emphasize that you should have adequate experience before accepting a position here in the United States. Many nurses coming here to the United States think that, oh, I will be okay because they will train me. While training has a limit. Training and adaptation is going to be dependent on the hospital facility as well as the policies of that particular institution. Some institutions will give a 2-week clinical orientation, some 4 weeks, and others may be longer or shorter. And therefore, you have to be aware of that particular length of orientation that each hospital may have. This is actually a concern that I voice in nurses that come to the United States without any previous experience, or if they do, it is an experience that is actually not going to help them. As an example, if you are a clinic nurse, or maybe you have worked in a 25-bed capacity hospital, this is going to be a challenge once you come to the United States, because that particular experience that you may have is actually inadequate for you to practice safely here in the United States. I hope that in this particular podcast that you were able to extract information that is important for you to start your clinical practice in the United States. Again, my name is Dr. Tom Madayag, and I thank you for listening to this podcast. Once again, I want to thank you for your participation. Please like, comment, share, and subscribe to my YouTube channel. Thank you.